and we're recording. So I'm going to start. I'm going to just run through your little survey that you completed.
Okay.
So you're in Fermanagh, isn't that right? You're in Enniskillen.
Yeah.
Okay. And so you trained in London. How long have you been kind of in Fermanagh in the last wee while?
6 years.
You're in that post 6 years. Okay, good. And that's primary care, GP.
GP practice.
Okay. And so tell me a little bit about the courses that you did, the healthy lifestyle support and the CHOC. Tell me a little bit about those and what those involved.
So all throughout my training, obviously, my job really centers around providing people with information on healthy lifestyles, and my training has always supported that, whether it's I did degree level for my nurse practitioner. No, I did degree level for my, I did a BSc in practice nursing and in 2001, which actually I haven't put on there. And then I did my advanced nurse practitioner course at master's level before I came to Ireland, so 6 years ago. And obviously there are no specific modules on healthy lifestyles, but all of the underpinning of the course is around healthy lifestyles.
Okay. And when you say no specific modules, so what can you give me a little summary of the areas that you covered that would enable you to talk about healthy lifestyles?
So if we were doing chronic disease management, for example, diabetes, then 75% of diabetes management in primary care is around creating healthy lifestyles and educating patients on healthy lifestyles. So to do with their diet, exercise, trying to maintain their blood sugar levels, and trying to encourage them and motivate them to do that.
Okay, so it was kind of nutrition and activity associated with managing chronic disease.
Yes.
Okay, cool, that makes sense. And then you also did a bit of training for that CHOC, both for non-healthcare professionals and healthcare professionals.
Yeah, so that was my role was to train the trainers. Okay. So healthcare professionals and non-healthcare professionals in all sectors, really, public and third sector areas, to address the issue of, to give them the confidence to communicate and address the issue of, weight-related problems, particularly with families and children, and give them the skills to do that.
Okay, and what sort of skills?
And the other part of it was actually working with the families and children myself. So I would, go in as a healthcare professional and record weights, do their BMIs, and do some teaching with the parents and the children on, nutrition, exercise, that kind of area.
And when you said there before about teaching the skills to, I suppose, improve their confidence in talking about this issue, what sort of skills would you have taught?
So providing them with the basic skills on how to tackle the issue, how to, what kind of communication skills they would need to bring it up if they, were in a, they were providing groups or seeing patients, and they needed to identify that there was a problem and communicate it to the parents or the children. So we were providing them with communication skills in order to do that. Okay. So it's kind of a little bit like what your thing is about, trying to equip people.
Yes, that's what I'm realizing. So can you tell me, you're obviously well experienced in this area, which is good for me. So can you Can you tell me a little bit about even just summarising the communication skills and what they were and how you taught them?
So we would do scenario-based sessions, and give them examples of how we would word things and communicate it to parents if they came into, for example, if they came into the GP surgery and they came about a sore throat or something else, and they came with a child, and you noted that they were overweight. How you would deal with that. So we gave them different communication skills, provided examples of how would be the appropriate way to highlight the issue, and how you first deal with it.
Okay, yeah, makes sense. So I mean, and where would you have kind of formed that information? Was it informed by theory or practice, or?
Yeah, so the theory, the actual course, or the to train the trainers, was provided by Imperial College.
Okay.
They wrote the program, and then we delivered it.
And that was a CHOC program?
Yeah.
Yeah.
You need to have a look at that, because it's, I'm not sure if it's still going, because obviously I haven't been involved with it now since I came to Northern Ireland. But I do know the people involved, and I suppose I did have a look at it this morning, and I couldn't work out, although it looks like it. I do have a friend who's still doing it, but I'm not sure, how much, because it was, they were trying to integrate. Have you heard of the MEND program?
Yes.
MEND?
Yes.
So CHOC sort of ran alongside MEND, and I'm not even sure if MEND is still going, but CHOC was trying to really offer the healthcare professionals or other organizations the skills to really highlight the problem and to be able to
communicate.
Well, to communicate, but also to know what the problems were related to being overweight, and to be able to understand why they were delivering their message.
Yes. Yeah. Okay, that's very interesting. I'll certainly want to look at that. So you said the last time you did training was 3 months ago, and what was that, Anne?
That was a diabetes course.
Diabetes, yeah. There's a big push. So, and then
I've just been on a course last weekend in Edinburgh, and again, there's lots of stuff on that, on asthma and diet around asthma management. What the problems that weight is causing for particularly children with asthma.
Yes. Yeah. Okay. And then you're planning to do further training in the next 6 months.
I just go to training all the time. As part of my role, I have to keep up to date with what's happening, and there would be, on a weekly basis, there would be updates, from different organizations coming in. There might be diabetes related, it might be COPD, or it might be asthma. It might be to do with women's health. Particularly around obesity, there's a lot of a drive to deliver information for us that makes it, to make it accessible for us in general practice.
Yes. Yeah. And because your role is quite wide reaching, you have to keep on top of all the kind of chronic disease areas. And and
because my role now is really governed by the people's poor health, really.
Yes. Yeah. So you've seen an increase in that throughout your career?
Oh my goodness. I can see the problems that diet and poor diet, as I say, people are overfed and undernourished.
Yes.
So that is creating a massive amount of work for us. And changing people's attitudes is very, very difficult. Changing their mindset.
Yeah. Yeah, absolutely. Okay, and then in the sources of further information, so you've said study books written by other healthcare professionals. So can you give me an idea of what sort of reading you've done?
Well, a few books, particularly, I suppose I would always look at what's the GP that Michael Mosley. Michael.
Mosley? Yeah.
Yeah. So I would look to him for a lot of information. But
Okay.
the other one is Ranjan Chatterjee, the Asian. He has a great book out, The 4-Pillar Plan, and at the minute we're just about to give people, so we're going to offer patients a 2-week challenge to change their diet. So we're going to put up a display in the waiting area and encourage people to take the 2-week challenge to stop eating processed foods and to try and change in order to increase their mobility, to prevent them having chronic inflammation. So, there's lots of stuff on that book that we're trying to implement.
Yeah, I've read it.
It's just a massive, area.
It is. It's kind of hard to know where to start and stop.
Yeah.
And then future training needs. So obviously you're quite happy with your communication skills as they are.
Well, it's never easy to bring, some people are quite open to it, some people, but I think we have an obligation to bring it up. It might not be something that people want to hear, and they might think that we're judgmental. But, as one GP once said to me, if somebody's BMI is over a certain, then you have an obligation to tell them that, this is putting a great strain on your heart, your kidneys, all the other things. And that's our role as a healthcare professional.
Yeah.
But that takes confidence.
Yeah, it does. It does, certainly. So I'm just thinking in terms of, just picking your brains on ideas for training. So obviously the training that you have already delivered yourself around that scenario-based learning, that sounds quite useful thing to do with people. Very
good. Excellent.
Yeah, and then
so we would take lots of different scenarios. It might be coming into surgery. It might be people going into after-school clubs. It might be youth clubs, things like that, and training the leaders to be able to address it, because it's so much now that nobody wants to talk about it. Nobody wants to, they look at it and they say, oh, but they're not addressing the issue.
Yeah.
So you'll know from the research that most parents will not know that their children are overweight. And we used to put up pictures of children in t-shirts and baggy t-shirts and say, ask the audience, do you think this child is overweight? And and then you disclose their BMI to them, and they would be astounded that they would say that child was overweight. That was for the trainers, so that's how we did it. The program was very good. I would definitely look at that program. I know I did when I came back from London. I spoke to, I think, was it the British Heart Foundation, or was it somebody in Belfast was going to offer something and it never came to anything. They were going to start they wanted to bring something out. No, maybe it's the
Chest, Heart and Stroke Association.
Yes. So I think they were hoping to win some sort of a project to deliver on, tackling childhood obesity. But it never came to anything.
Okay.
But there's lots of good training out there, that can be used.
Yeah, there's different types now, definitely available. So you tick the box around the science of weight and obesity. So what interests you in that area? Where do you think you might have gaps?
I suppose I would love to do a course in nutrition, because it's a personal interest, and I like all the science behind it. I like, particularly that Ranjan Chatterjee. His he provides a lot of the evidence behind what's going wrong when people eat all the wrong foods, and it's fascinating, and I would like to do some more on that.
Okay, that's great, Anne. Thank you. That's the training bit done. So what I'm going to do then is I have a few other questions. So I wanted to start with just general opportunities to talk to patients about weight. So what I'm interested in is just a little bit what you've already touched on is, how do you currently talk to patients about weight, and how do they react?
Well, I mean, very often I will see patients for other things like back pain, shortness of breath. A lot of it's back pain, joint pains, knee pain, foot pain, and I usually will, take all the history and examine them. But as part of that examination, I would usually say, can I just check your weight? Okay. And then I will work out the BMI, because we have a calculator on our computer screen. And then when I sum up and, talk about the problem and what I think is a problem, then I will say, of course, back pain, it can be very degenerative, and it can be very troublesome. But if you have too much weight, and I'll get out my skeleton and I'll show them exactly what I mean, then that will put more pressure, because all the bone structure is pulled forward because of the weight on your tummy. So usually that's how I do it. I get them on the scales, and then I will just, and I'll talk about if they have knee pain. I'll say, your knee is a really small joint, but it's having to carry a lot of weight. So, it's cringing under the pressure. And then we'll talk about, usually about what they eat, what exercise they do, and then we'll go on from there. And then I ask them, would they like to make changes? Have they thought about making changes? And of course, everybody wants to make changes. And sometimes when you do say to them, you mention their weight, and they'll go, oh, it's either do or die. Some people, but it's rare now that I would say people get, prickly about it. I'd say it's more common for them to be open and, take your advice.
Okay.
Sometimes parents are a bit more, and you have to be a bit cautious with, if you have children in the room. But I try and, sorry, that's the other thing that I usually use is the app, the children's app, the one that the NHS, that's got all the little, I can't think of the name of it now. Colourful app. That
I know the one you mean. Yeah, it's okay. I know the one you mean. So would you talk about weight in front of the child, or would you just talk to the parent?
It depends on the age of the child.
Okay.
If they're a toddler, I would usually talk in front. Sometimes if they're a bit older, and you can have, they're at the age where they can, you might not talk about weight, but you might ask them about what sports do they play, things like that. And then usually I'll talk to both about, what kind of things do you eat? What did you have for breakfast today? What will you have for your tea when you go home? And then sometimes I might suggest that they have a wee look at this. Have you ever seen, I'll just say, have you ever seen this website? it's got really good ideas, really good, you know, sometimes we all struggle with, and I'll very often sort of empathetically put it into, you know, as a parent would feel, and say, you know, sometimes when I'm really stuck for something to eat or putting lunch boxes, I look at this and, you know, there's lots of different varieties. So I highlight them and I say, and it's all computer based, so it's great for, you know, your young ones can use it easily. So that's how I normally do it. Just depends who I have in front of me and how they. It's once you know, get the weight done, and I suppose with confidence, but it's very sensitive issue, and I'm very aware of that.
Yeah.
And everybody's different.
So you generally raise a topic within, connect it to another condition that might be impacted by weight. Is that right?
Yeah, usually. I mean, some people will come in and say that they want to, you know, that they're worried about their weight, or they're trying to lose weight and they haven't been able to. And
all right, so that's what I was going to ask you. So what percentage of people would that be that would come in and raise it preemptively with you?
Probably about 10% is not very much.
Yeah, not very much. Okay. And you do the same sort of thing, then you'll go through, you know, what are you eating? Are you exercising? You know, how do you feel? All that sort of stuff. Is there anything that would indicate to you that you shouldn't raise the topic?
I suppose I'm cautious about girls and you know, particularly if they're teenagers, and I would be cautious about people who have mental health problems and who have lots, that I know have got lots of other things going on in their life, or, you know, people from lower socioeconomic groups.
So you kind of pick your moments, sort of thing?
Yeah.
Okay. And the teenage girls aspect of that, is that the kind of just the challenge that teenage girls are under anyway, or is there other reasons?
No, I think it's just to do with teenage girls and body image.
Okay. Yeah, so the body image.
And they tend to be the ones that probably need it, because the boys don't tend to have, I think girls are probably more prevalent around that age to be overweight more than the boys, or certainly that's what I would see here. So it's more of a problem with the girls, and it's not as easy to address it sometimes.
Okay.
Because I don't want to be highlighting that there is a body image, but I might then do it if there's mom and other children. I might do it as a family thing and say, you know, what kind of things do you all eat, or, you know, what did everybody have for breakfast this morning? Usually that's a good starter, and then you can sort of work from there.
Yes, okay, that makes sense. Okay, so that's opportunity to talk about weight. So my kind of final two questions are around trying to get an example from you. So, and you'd mentioned before about kind of changing people's attitudes and motivation and so on. So can you recall a conversation that actually helped to motivate a patient, that helped to improve their overall health? And just talk me through that. You know, how did you frame it? What advice did you give? And was there like ongoing support and so on?
So I suppose that, you know, a few things I've mentioned already. Just go back. What was the first part of the question again? Now,
so this is a specific example of how you have talked to a patient that actually has encouraged them and improved their health.
Well, I hope that I've got a few examples of that, but you know, if I was to pick out one in particular, I mean, I'm doing it, you know, daily. If I see 30 patients in a day, I'm probably doing it 75% of my patients now.
Okay.
So it's a regular thing. In terms of what I, how if I bring up a situation and they say, oh, I'd love to lose weight, and then, we look at diet, kind of go through that, maybe give them some basic information. Usually before I embark on that, and I'm in a very privileged position because then I can do the bloods and look at their blood tests so that I make sure that there's no underlying problems. So on my first visit, or my first time I see them, I will, and this will be mostly for everybody, if they might come in with mental health problems, they might come in with back pain, knee pain, so those things that I've mentioned before. And when you go down to and you're talking to them, for example, around mental health, the fact that their weight is increased, that can cause mental health problems. So you're talking about, you've got a 10-minute slot, and then I will usually say, would you like to do something about your weight? What have you done before? What have you found helpful? What, tell me what exactly you've been up to and what you've done. And then I will say, well, why don't we just do your bloods first, make sure that you've got no problems, and then I'll make a review appointment. So then I would see them again, usually 2 weeks later, when all the results are back. And then when I'm closing off that consultation, I will usually give them, I've got a sheet that I've printed out, which is kind of, it's not about diets, it's about what kind of things you can change simply, to do with diet and exercise. And I'll usually, when I talk about diet, I'll go through that sheet, and then with exercise, I'll just encourage them to go out. I don't want them to go to anything expensive or do anything. I said walking is fine, and I would suggest that they walk 5 times a week and build it up to half an hour. And then, so I would see them in 2 weeks' time, and carry on from there. And they can tell me what kind of changes they've made. And then we would sort of do weights, and I might see them then for, might be 2 months, 3 months, depending on the patient.
Okay. So you outlined some of the risks of weight, and do you ever talk about kind of the reward side of things, about how it might improve people's health? And
oh yeah, I mean, I suppose I'm taking it all for granted that usually they will tell me what they think the rewards are for them. I'll kind of get them to highlight what they think would be. They'll say, oh, sometimes when I say, can I just weigh you? Because we haven't had a weight for a long time or whatever. They would say, oh, I know I'm overweight. That's something I'm trying to address. And then it will go from there, and I say, well, why do you want to lose weight? What's your motivation? So we will go through some steps like that.
Okay, that makes sense. Yeah.
To get them to a point where they're, motivated, and, they've got to do the hard work themselves.
Yes. And so you obviously talk about diet quality as well as kind of the basic nutrition side of things. You talked about swapping out different types of food and reducing processed food. Is that those sorts of conversations you have?
Yeah.
Okay, grand. And then do you talk about, as well as say reducing weight, it can improve other health markers? Obviously you talk about that as well. Okay, good. So if someone isn't that motivated, are there any things that you can do to help that, or do you kind of visit that another time?
Well, it's like the cycle of change,
Yeah.
Some people will be open to suggestions, and some people won't, and then they're on that cycle, and you know, they might have to go around a couple of times and come back to me a couple of times with the same problem before they, you know, are at that point where they're accepting of, you know, support. So you kind of have to gauge, you know, if people aren't motivated, and I find that much more so in Northern Ireland, people are very reluctant to make lifestyle changes than they were in England. People would like to hand me their health and for me to take control rather than them taking control.
Right.
So but if they've got back pain,
Any
and
thoughts on why you think that is?
sorry?
Any thoughts on why you think that is?
I think it's just that we're still in that, living in that era where it's the doctor's responsibility to make you better.
Okay.
And we haven't educated them enough that actually it's their responsibility. And maybe there's been more education in England. And I'm from Monaghan originally, so I didn't grow up in England, but definitely that's the biggest thing I've noticed, and the biggest challenge for me is getting people to accept responsibility for their health.
Okay, that makes sense. Okay. All right.
And maybe that's where the education needs to start, that actually it's not, you know, people will say to me, you give me a tablet, you fix it for my back pain. You know, people have said to me, it's your problem, you sort it out. And then, you know, you're on a slippery slope.
Yeah, there's not really much further you can go there.
No.
Okay, that makes sense. So you can see people for a few times depending on what their condition, and you have a bit of opportunity then to have ongoing conversations.
Yes, yeah.
Okay, so that makes sense. All right, so if we could reflect on then maybe, so obviously you do a lot of work with patients in this area. You have 30 patients a day, that's quite amazing. So, I mean, can you reflect on a conversation around this area on weight that you think could have gone better, and what would you do to change it?
I mean, it's I'm trying to think of one, because it was a mother and the child came in for, I can't remember now whether it was back pain or something, but the child was, you know, very overweight, and you know, we had to have that discussion because, you know, there was nothing else causing the back pain, it was just about weight. And I think the mother went out and complained that I, you know, had addressed that issue.
Okay.
What could I have done better?
Or differently?
Or differently? I don't know. It's, you know, you never know how people are going to react, and you know, I have to be honest in the job I do. It's difficult to know what would I have done differently. Maybe when I sensed her, you know, because I'm sure her body language must have, you know, told me at the start that, you know, this was going to be tricky. Perhaps I could have had a better way of wording it.
Okay. Okay. And then, I mean, do you ever get a sense of frustration with patients, or over kind of lack of progress, or how much time they take on that cycle of change? Or even maybe not with patients themselves, but with the situation?